Of discussion today is leptospirosis. So first, what is leptospirosis? So this leptospirosis, this is a zoonosis. Leptospirosis, so this is a zoonosis, and this is caused by pathogenic spirochetes of the genus Leptospira. So what is the genus? It is the Leptospira. And so this leptospirosis, what are the other synonyms for this leptospirosis? So this is also called as Weil's disease, or we can also call this disease as canicola fever, or this is also called as rice field fever. So leptospirosis, it is a zoonosis that is transmitted from animals to humans, and the genus here, it is Leptospira. This is also known by different names. So it is also called as Weil's disease. So this is also called as canicola fever, and this is also called as rice field fever. And we can also call it as swamp fever or swineherd's fever, swamp or swineherd's fever. So there are different names or different synonyms for the same disease. And then coming to what is this leptospira? So this leptospira, so this is a spiral shaped organism. So this is a highly motile, and it is a aerobic spirochete. So this is having 18 or more coils per cell. Spiral shaped, highly motile aerobic spirochetes with 18 or more coils per cell. They can be distinguished from other spirochetes by their unique question mark hook at the end of the bacterium. So what will be there at the end of the bacterium? So there will be a question mark hook at the end of the bacterium. Is it motile? It is motile. Is it spiral shaped? Yes, it is spiral shaped. Is it? It's a aerobic spirochetes. So it is having 18 or more coils per cell, and this has got a question mark hook at the end of the bacterium. And so what are the reservoirs of this organism? So this leptospirosis, so this has got animal and environmental reservoirs. Leptospirosis has got animal and environmental reservoirs. So mammals are the primary reservoir. Which reservoir? Mammals are the primary reservoir. And if urine of this infected mammals, if they contaminate the environment, so then environment also will become the reservoir. So if the urine of the mammals, if it contaminates the environment, so this environment also becomes a reservoir. And here approximately 160 mammalian species, so they have been identified as the natural carriers of this pathogenic leptospira disease. So of these mammals, rodents, rats, rodents are the most important reservoirs. See, we have different mammals, like cattle, swine, dog, but rodents are the primary reservoir of this leptospirosis. Leptospira icterohemorrhageae. Leptospira icterohemorrhageae. So this is the classical parasite of rats. So which is a parasite of rats? Which is a leptospira, which is a parasite of rats? So it is Leptospira icterohemorrhageae. Leptospira canicola, so this is the parasite of dogs. Canicola means dogs. Leptospira icterohemorrhageae, it is a parasite of rats. And environmental reservoirs. So if environment or like pools or fresh water, if this water, if it is contaminated by the urine of this rodents, so what will happen? So the organisms can survive for days to months, because environment is also reservoir, and we have animal reservoirs also. Of this 160 species are there, but rodents are the primary reservoir. Ectohemorrhagia is a parasite of rats, and canicula is the parasite of the dogs. And from this animal reservoirs and from this environmental reservoirs, how does humans get this disease? How does transmission occur to humans? So transmission occurs to humans when they are infected incidentally after animal or environmental exposure, like through cuts or abraded skin. So humans get the disease. So it is a zoonosis. Genus is Leptospira. So this is also called by different names: Weil's disease, Canicola fever, ricefield fever, and this is also known by swamp or swineherd's fever. So it has got animal and environmental reservoirs. Mammals are the primary reservoir, of which rats are the primary reservoir. And from this see, this rodents, no, after they get infection, they will be asymptomatic. They'll be lodging this leptospira in the renal tubules. So what will happen? This, if the urine of this rodents, if it contaminates the environment, soil or water, what will happen? So humans get infected, and this is an accidental exposure. Okay. And so what are the clinical manifestations of Leptospira? Why this is not writing? Okay. So clinical manifestations of Leptospira. So what are the clinical manifestations of Leptospira? So the clinical course of this leptospirosis, no, so this is variable. The clinical course is variable. Most cases, no, so they will be mild and self-limiting. But if syndromes, so these are also caused by leptospirosis. Most of the cases are mild and self-limiting, but syndromes are also caused by leptospirosis. So in this we have two categories. So one, it is anecteric leptospirosis, and we have icteric leptospirosis. So syndromes are caused by leptospirosis. So in this we have anecteric leptospirosis, and then we have icteric leptospirosis. Majority of the patients have this anecteric leptospirosis. Majority of the patients, no, they have this anecteric leptospirosis. So this anecteric leptospirosis, so this has been described as a biphasic illness. Syndromes are caused by leptospirosis. So there are two syndromes, anecteric and icteric leptospirosis. Anecteric leptospirosis, it has a biphasic illness. So in this we have an acute phase, and then we have a immune phase. Under anecteric, so this is a biphasic illness. We have an acute phase, and then we have a immune phase. So this acute phase, no, so this occurs in the first week of the illness. Acute phase occurs in the first week of the illness, and it will last typically from 2 to 9 days. So this acute phase, it occurs in the first week of illness, and it might last from 2 to 9 days. So how is this acute phase characterized by? So this acute phase, it will be like any acute febrile bacteremia. So this acute phase, no, it will be like any acute febrile bacteremia. So here patient will have fever, patient will have rigors, patient will have myalgias, headache, and all those things, like any fever. So in this acute phase, patient will also have this acute febrile illness during the acute phase. In immune phase, patient will have this aseptic meningitis and patient will have uveitis. Okay. So two syndromes are caused by leptospira. One is anecteric leptospirosis, other is ecteric leptospirosis. So this anecteric leptospirosis, it is a biphasic illness. So it has got an acute phase and it has got an immune phase. Like acute phase, that is the first 2 to 9 days, it will be like any other type of fever. But the most important point during this acute phase is, so what you have to remember is, so this acute phase, like generally, main important thing is patient will have the conjunctival suffusion. So patient will have a conjunctival suffusion during the acute phase. So this conjunctival suffusion, so this is characterized by, it's a bilateral dilatation of the conjunctival blood vessels. Conjunctival blood vessels, so they are getting dilated. So this will cause conjunctival suffusion. But here, no, there won't be any purulent discharge. Whereas if you take any other bacterial conjunctivitis, so this will be characterized, those bacterial conjunctivitis, they'll be characterized by a purulent discharge. But here, conjunctival erythema without purulent discharge. So this is common with leptospirosis. So here you can see the diagram here wherein there is a conjunctival suffusion. So in the fever will be there, and we also have to look for this conjunctival suffusion in endemic areas of leptospirosis. So here, no, these are the epidemiological setting for leptospirosis. See here, here it is a pig, okay, but rats are the primary reservoir. So there was a echo challenge contest in 2000, okay. So in this echo challenge contest, which was held in Borneo, Malaysia, 189 participants were there. So they were exposed to this rain swollen Segama river was in Malaysia, and of these almost 80 patients, no, so they developed leptospirosis. So this is the animals or the mammals or the primary reservoir. If any water body, if it is contaminated with urine, no, so then humans get the infection. And conjunctival suffusion will be there in the acute febrile illness. Fever will be there. Along with that, in endemic areas, we also have to look for this conjunctival suffusion. And then we have the immune phase. So following the acute phase, no, a minority of patients, biphasic illness. So though it is a biphasic illness, acute type of illness, it will be more. But few patients, no, they can go into immune phase. So this is called this minority of patients, no, they develop this immune phase of illness. And here in this immune phase, what will happen? Leptospires are absent from the blood, and antibodies will be present to this organism. So in this immune phase, so this is characterized by aseptic meningitis. So which is the hallmark of the immune phase? The hallmark of the immune phase is aseptic meningitis. So aseptic meningitis means patient will have headache, patient will have neck pain, and these symptoms, no, they usually subside within 1 or 2 days. And then what is the other presentation in immune phase? The other presentation in immune phase is uveitis. So it could be a unilateral uveitis or it could be a bilateral uveitis. So of this, no, anterior uveitis is more common. So this usually So in anterior uveitis means, so it manifests as either iritis or it manifests as iridocyclitis. And this has got a good prognosis. And then coming to the icteric phase. So in syndromes caused by leptospirosis, we have anecteric. So in anecteric, we have a biphasic type of illness. One is acute febrile phase and other is immune phase. So in this immune phase, we have this aseptic meningitis and uveitis. And then coming to icteric phase of leptospirosis. So in the icteric phase of leptospirosis, so this is seen in approximately 5 to 10%. That is, it is the most severe manifestation of leptospirosis. So this icteric leptospirosis, no, so this is characterized by fever, jaundice, and renal failure. So this icteric leptospirosis, so this is characterized by fever. You have to remember three things: fever, jaundice, and renal failure. Jaundice means there will be conjugated bilirubin will be elevated, and what happens, liver enzymes, no, normal or mild elevation of aminotransferases will be there. And liver failure, no, it is rare, but liver failure also might occur. And then when coming to the renal failure, so it could be a oliguric or it could be a non-oliguric type of renal failure. So what happens in renal failure? There will be elevation of the serum creatinine will be elevated, and few patients, no, they might also require hemodialysis because of the severe acute kidney injury. So icteric phase, it is seen in 5 to 10% of the patients. It is characterized by fever, jaundice, and renal failure. So renal failure, it could be oliguric or non-oliguric renal failure. Serum creatinine will be elevated, and few patients might also require hemodialysis. If jaundice is there, conjugated bilirubin will be elevated, and mild elevation of liver enzymes will be there. And in the severe phase, even apart from this, what happens, even lungs also will be involved. So here there could be a severe pulmonary disease. So this severe pulmonary disease, no, so this will be characterized by pulmonary hemorrhage. Pulmonary disease characterized by pulmonary hemorrhage. So if what will be the symptoms if there is pulmonary involvement? The symptoms will be shortness of breath or cough or hemoptysis. And if we do a X-ray, so what can we see typically? We can see bilateral consolidation, or there could be a bilateral ground glass appearance. In pulmonary hemorrhage, how will be the presentation on imaging or on a chest X-ray? What will happen is there will be a bilateral consolidation, or there will be ground glass opacities. And so even in severe disease, even heart also will be involved. So what will happen, there will be myocarditis will be there, and heart failure also might occur. ECG will show some non-specific findings, and then vasculitis also will be there. Vasculitis also might occur with necrosis of the extremities. So if we take this icteric form, it is seen in 5 to 10%. There will be fever, jaundice, and renal failure. Apart from this, even heart also will be involved, even lungs also will be involved. So in lungs, there will be severe pulmonary hemorrhage. In heart, there will be myocarditis and heart failure, and vasculitis also might occur with this disease. So this leads to necrosis of the extremities. Okay, then coming to the diagnosis. So how do you diagnose this disorder? So the diagnosis, no, see, this disease, it will be particularly endemic in particular areas. Like if any fever is there, we have to look for conjunctival suffusion. So a high index of suspicion, no? So this is necessary to make the diagnosis in non-endemic areas, but in endemic areas, fever, conjunctival suffusion, and severe syndromic variant. So in this we can say fever, jaundice, and renal failure. So even renal failure will be to such severe extent that patients might go in for dialysis. So for diagnosis, what you have to do is you can send the blood sample, or you can send the urine sample, or CSF for PCR, that is polymerase chain reaction. That is, it detects the nucleic acid of the organism, so it will amplify that nucleic acid, and so we can detect the leptospirosis. So what are the samples which are required? Blood sample, urine sample, or CSF sample is required to detect the leptospirosis by polymerase chain reaction. And so this is how we can detect leptospirosis in the first week. And then we have the serological test. So in serological test, we have microscopic agglutination test. So that is, we are detecting the antibodies to the antigen. So initially in the first week of illness, there will be a minimal elevation of antibodies will be there. So what we have to do is, in the first week we have to send blood for antibodies, and again we have to send blood for antibodies after 7 days. So if there is a 4-fold increase in antibodies, then we can antibodies means IgG or IgM antibodies. So if there is a 4-fold increase of antibodies in the second sample, so then we can confirm the diagnosis of leptospirosis. And dark field microscopy test also has been advised, but this has got low sensitivity and specificity. So for diagnosis of leptospirosis, what you have to get? We have to get a PCR, okay, polymerase chain reaction test. The samples are, you can take a blood sample, urine sample, or CSF sample from the patient. So we can detect leptospirosis in the first week of illness, because this will amplify the nucleic acid of the leptospira. And then we have the first, this is the polymerase chain reaction test, and then we have the microscopic agglutination test for detection of the antibodies. So first week to second week, if there is a 4-fold increase of antibodies, then it confirms a diagnosis of leptospirosis. And we can also send blood cultures, but it culture of the blood, okay, but this takes a long time, like 2 weeks to for detection. For the growth of this organism, it will take from 2 weeks to almost 3 months. So here you can see the here you can see jaundice, you can see the conjunctival hemorrhage, okay. So this is the x-ray, like it could be these are the patchy opacities which are seen in the bilateral lung fields. And then what is the treatment of leptospirosis? So in the treatment of leptospirosis, so most cases of leptospirosis, they are self-limited. And we have to remember one important reaction. So that reaction is Jerisch-Hersheimer reaction. That is, if we give antimicrobial therapy for leptospirosis, Jarisch, Jerisch-Hersheimer reaction. So this Jerisch-Hersheimer reaction, it occurs following antimicrobial therapy. So if we give antimicrobial therapy for treatment of leptospirosis, so this reaction might occur. So this is a acute inflammatory response because of the clearance of the spirochetes from the circulation, okay. Because spirochetes are cleared from the circulation, what will happen? So this is a acute inflammatory response to clearance of the spirochetes from the circulation. So this reaction, no, so this is characterized by fever, rigors, and hypotension. So this is Jerish-Hersheimer reaction following antimicrobial therapy for leptospirosis. So then what is the treatment? So for mild disease, no, how do we treat the mild disease? So this is treated by doxycycline. Orally we can give doxycycline 100 mg twice daily for 7 days, or we can give azithromycin 500 mg once daily for 3 days. So how we treat? Mild disease can be treated with doxycycline 100 mg twice daily for 7 days, or we can give azithromycin in cases of mild disease. Azithromycin 500 mg once daily for 3 days. And for severe disease, what you have to give? For severe disease, we have to give penicillin. So how much penicillin you have to give? 1.5 million units IV, okay, every 6th hourly. So in severe disease, that is, severe means this icteric form, you can see the jaundice here, no, yellowish discoloration of the sclera. So in the severe disease, penicillin 1.5 million units IV 6th hourly, and IV doxycycline also we can give, and we can also give ceftriaxone, okay, 1 to 2 grams IV once daily, or cefatoxime also can be given. And apart from this, we also have to give supportive care, that is patients who requires oxygen, they can give we can give this oxygen therapy, and supportive ventilation also we can give in case of ARDS, or if there is pulmonary hemorrhage, or consolidation, okay. So oxygen therapy, hemodialysis in case of renal failure, that is, those are all the supportive care. So the major antibiotic treatment for severe disease, so it is penicillin, okay. Penicillin 1.5 million units IV 6th hourly, doxycycline 1 to 100 milligrams IV twice daily, and then we have this ceftriaxone. So ceftriaxone, how much we have to give? 1 to 2 grams IV once daily, or cefatoxime we can give. And if we give tetracyclines, no, like this tetracyclines, they cause tooth discoloration in children less than 8 years. Tetracyclines, they cause tooth discoloration in children less than 8 years. And so pregnant women who are infected with leptospira, so they can also be treated with penicillin, ceftriaxone, and cefatoxime. So we will just revise the important points. So this is also okay. We'll just revise all the important points. So it's a zoonosis caused by leptospira. So this is also called as Weil's disease, or canicular fever, or rice-whale fever. Animals are the primary reservoirs. Environment is also a reservoir. Rodents are the primary reservoir. Icterohemorrhagia in cats, and canicular in dogs. And so it is a spiral shaped organism. It's an aerobic organism. 18 or more coils per cell will be there. So clinical course is variable. So there are 2 syndromes, anecteric and icteric. And anecteric, acute phase, first week of illness. Immune phase, so it's in anecteric phase we have 2 phases, acute phase and immune phase. Icteric phase, and so in immune phase, what are the manifestations? It is aseptic meningitis, and it is uveitis. And so this is the mammals which are the reservoirs. And then we have PCR test for detection, microscopic agglutination test for detection of antibodies, blood culture sensitivity, and dark field microscopy. And then we have treatment, so Jerish-Hersheimer reaction, which is important. And then we have treatment, mild doxycycline for mild cases, and for severe cases penicillin 1.5 million units IV 6th hourly, along with we can also give doxycycline and